All
Welcome
right.
everyone. Friday afternoon, Matt Wheeler, the shoeless therapist, hence the showing us that his socks therapist is joining me today. And what I saw a hint of teal, I
You
think.
did you saw a lot of teal.
Oh, very cool. Oh, cool. Little cameras.
They're little cameras.
Very
And
cool.
I pulled these out.
Back from the olden days when there
Oh,
was cameras and they weren't just in your phone.
yeah, there's like Polaroids, there's other types of cameras. They're fun little cameras. And I
Yeah.
I was super excited when I brought these out this morning. I hadn't seen them before actually.
I can only imagine your sock drawer has treasures.
Yeah, no, it is quite fascinating. I actually have them. I have a whole shelf in my closet and I have a bunch of different baskets. And I've been trying to figure out how to rotate them so that, they all get attention.
Which makes sense. It would be
Right.
unfair to be, ignored in your sock world. So maybe
Right, right.
we're three different pairs in a given day to help them. So yeah. So anyway, so, we digress. So Matt, what topic do you have for us today?
Well, we are going to dive into something that often people ask me is if there's been injury in the relationship, um, whether it's betrayal or any type of any type of hurt, injury, struggle. People are like, well, when do we do couples counseling? When do we not? That sort of thing. And the probably the simplest way to try and explain is the most difficult type of couples counseling to do is when neither partner has a very good ability, when neither partner regulates themselves well, right? So you have two highly escalated partners. And what that looks like is then they get into a room with the therapist and both of them want to talk and tell the other person all the harms and all the issues, and the therapist is trying to slow them down and help them regulate. And it can be pretty difficult as a couples therapist. It happens. We come to expect it, and we're doing our best to help them regulate and work through things because the issue you run into is two highly escalated people who don't know how to self-regulate well, aren't going to get very far. So it doesn't necessarily mean that you shouldn't come in and see a therapist when both are highly escalated. A lot of the times, a therapist is actually practicing helping them to regulate. So the therapist is practicing co-regulation, and I'm going to maintain regulation as a therapist. And I'm going to help you co-regulate, and then I'm going to help you co-regulate, and I'm going to help try and navigate this so that we can bring a little bit more or a lot more regulation to this situation, to this environment, and hopefully then start to be able to actually address things. Um, Now, I was talking about de-escalated individuals um, who are basically both very vocal. Well, sometimes you have a highly escalated individual, and their method is to disconnect and detach. Well, I have a highly escalated person who gets loud. I have a highly escalated person who disconnects, whether they're withdrawn, whether they're silent, whether they're dissociated of some type, right? They're not engaging, and the other person is over engaging, if that makes sense. Well, a therapist, a lot of the times in that case, will work to de escalate the escalated partner and then work to de escalate, I shouldn't say escalated partner, the vocal partner, and then work to de escalate the shut down partner, the withdrawn partner to get them to engage, right? So, the truth is, as a therapist, as a couples therapist, you're trying to figure out how to get them both to regulate through co-regulation so that we can actually start to work through injuries, repair, create better relational agreements, more understood, clear relational agreements. Um, and so it might seem it often can be more, it can often be difficult when that dysregulation is occurring. But sometimes you see a disconnected and shut down partner and you're like, oh no, they're calm. And it's like, no, they're not calm. They have all sorts of chaos going on inside. I just have to create an environment that I can start pulling that out, start getting curious, start understanding it. Um, and then So obviously, ideally, I mean, and that's it's kind of absurd to say this, like ideally, both individuals are regulated and I can help dive in and understand the wounds, the injuries, and the things that need to be shared and worked through. And so in the beginning of um, sexual compulsivity or addiction work, oftentimes that is why we are told, like, both of you have your individual therapists. And there's a lot of value in that because you have one person that you can go to, that you develop a rapport with, that you can be open with, and they can work on you individually. It's like they're doing emotional, open heart surgery with you, trying to figure out how to help you and strengthen you, and get you the tools so that you become better at regulating. And if you obviously have some type of compulsivity or addiction, they're trying to get you to use that compulsivity or addiction to regulate less and hopefully, obviously, not at all, and use other things much better. And this is why, um, if somebody struggles with an addiction or compulsivity, right? It's become their primary coping mechanism. It's oftentimes their only coping mechanism, and it why it's unrealistic to just say, just don't do that anymore. And then even though that sometimes can happen, you have to replace it with other coping mechanisms that usually that person just doesn't know how to do. And it's interesting because the most painful coping mechanism that I've found in a relationship, and I don't want to be super definitive because there could be other things, but off the top of my head, the most urgent and necessary one is usually not the addictive, compulsive behavior, and this won't come as a surprise to Tammy. It's the coping mechanism of managing the other person's emotions, which often is really done through deception, dishonesty, a lack of transparency. And so it's interesting how often someone can stop the addictive behavior fairly quickly, but yet it's like, oh, they're still lying, they're still lying. And it's like, yes, because are we seeing that this is one of their coping mechanisms? This is one of the things that they've learned to do. So we actually have to then discover that and unwind that. And so couples therapy can be really interesting because sometimes we're practicing regulation skills and we're practicing opening up and starting to figure out what the dishonesty looks like. And people can get so frustrated because it's so painful. They're like, oh, if you just stop lying, and not realizing that's actually one of the major things we are trying to figure out. And they're like, would you just stop? And sure, that'd be great. Except we have to often get to an understanding that that's a coping mechanism, then figure out why it happened, then figure out how to change it, how to work through the discomfort that all that lying learned to comfort, right? Learn to cover up. So when do we do couples therapy? Well, Tammy has said this before, that There's probably a lot of couples therapists that early on you might not want to see, and you just focus on individual work. There are some couples therapists who can get in there and really start helping early on, but you got to make sure that they know what they're doing and that they're good at it. And it can still be terribly frustrating. It can still be really slow, but it can also help people recognize that we are ultimately working on the relationship here, right? Too often people will go their own paths and sometimes do some really good healing and then start the relational work very late. I don't want to say too late, but often later than they needed to, much later. So relational work really can be done, but we have to have some understanding of what is the expectation there. Just because you're going to come in and pour your heart out and share all of your injuries doesn't mean your partner is going to know how to show up and make the changes. However, it can help, but it's generally going to be slow. Relationships are where most of our biggest injuries come from. So creating a trusting relationship and creating repair is going to be probably our slowest injuries to repair, are the hardest ones to repair. So, uh, so really, when people ask me, what's the most important thing we can work on, either before or at the start of couples work, I will often say it's practicing self-regulation. And how do we do that? Well, through self-care. We do that through getting good sleep, eating well, exercising, taking care of ourselves in healthy ways. And so the more we learn to take care of ourselves in healthy ways, the more we practice being uncomfortable in uncomfortable emotions, the more we learn to regulate. So I'll share one quick little thing that came up. I was doing a little bit of doom scrolling the other day, and I ran across a video of it's a Phoenix police officer who had a confrontation with somebody. They had the body cam footage. And it's interesting because I've actually shown this to a group of people, and it was funny how everybody saw a bunch of different things. But I actually thought the officer did a pretty phenomenal job at staying calm and staying regulated. Now, they are trained to do that, to stay regulated in an intense situation. If you dysregulate, you aren't going to be able to protect yourself, protect the public. You aren't going to be able to protect the individual who might not be doing good things, right? The whole idea is protect and serve, right? So, um, but as I watched it, because of the intensity of the experience, I felt my body like feeling all that intensity. And I actually noticed it, and I just spent time in my body going, okay, what is this? And what does this remind me of? And how old do I feel? And it took me back to just realizing, wow, I haven't been in this type of a screaming, cussing, intense environment in a long time. I see some things, I mean, I have couples that get mad, I have couples that cuss, but this was a whole different level, right? And but I sat there noticing what was happening in my body, and it reminded me, gosh, in order to stay calm in a situation like this, in order to stay calm as couples when we have conflicts, we actually need to learn to get comfortable in the discomfort. And so when people ask me like what is one of the best things I can work on? It's like learning to be comfortable in discomfort, learning to be comfortable in sadness, learning to be comfortable in hurt and pain and loneliness and fear. But if we learn to be comfortable in those things, we're less likely to go to substances or unhealthy coping mechanism. We're less likely to blow up and get mad at our partner. So learning self-regulation is huge, and it happens most commonly through self-care and learning to be open and talk about difficult things within ourselves and within others. And with that, Tammy, I'll jump back to you.
Okay. I had a question because you're talking about the escalated partner who looks calm.
Yeah.
like, how do you discern, like, that person looks calm, but they're not? How do you even, like, what would be some
Well,
signs, I guess?
I mean, the reality of it is, if I'm in a conflict with another human being and they're not talking to me,
Mm.
they're ignoring me, I know they're not calm,
Oh, interesting. Okay, that makes sense.
right? Because if they were calm, we would be having a conversation,
Right. Okay.
right? It doesn't mean like when I watched that body cam footage, which
Uh-huh.
again, that's not normal for me. I don't know how I even ran into it, but I actually it was a good experience for me for a lot of reasons. But when I ran into that, the one thing I noticed is the cop stayed present and calm and and didn't disengage. They stayed engaged, but didn't weren't aggressive as far as I could tell. And the voice, the tone of voice, and all of that. So it doesn't mean that in that moment the police officer himself wasn't feeling fear and nervousness. Because I'll be honest, I would be shocked given this situation if he wasn't nervous and feeling scared. But like he was able to keep a regulated space. So it doesn't mean we don't feel disturbance, but being calm is they stay engaged, they stay present. And so somebody can be quiet, can look very still. Are they giving me eye contact? Are they engaging with my words? Um, are they nodding? Are they showing like physical engagement, right? They don't even have to be using their words, but like you and I'm
Mhm.
sharing all of this, and as far as I can tell, you're engaged and listening. And then as soon as I got done, you're like, "Hey, I've got questions," and I'm like,
Yeah.
"Okay, you're in this with me."
Yeah.
When somebody is quiet but not calm, they're ignoring, they're disengaged, they're glassed over, they're distant. You don't feel heard and understood, right? Those are some of the signs that help me go, "Oh, this person's not okay." And I will often with a client or even a friend, I might say, "Hey, you okay?" Like, "Hey, are you breathing?" Because I'm watching for breath. I'm watching for, ab reactions, that sort of thing. Um, and so I can do certain things to try and pull somebody back to the present. But if they're dissociative, if they're ignoring, giving the silent treatment, looking away all the time, then I'm like, okay, this person's not calm, even if they look fine.
That makes sense. Okay. So then, yeah, and we do talk about, and this just reminds me of what an art this is. It isn't just about the head learning, which, we only recommend people who are trained a certain way. But then there's still also this art, to doing therapy. And I think the good therapists, like you are able to read people, and it's not just this is what we do, that rote, kind of, I mean, seriously, I do know some of them that are just, here's another
Oh,
workbook, here's another whatever. So, but
yep.
my question then is, okay, when you have couples that come in and they're dysregulated, do you find that that's a recurring pattern? Like every week they're coming in and they're dysregulated, and you have to start from that, or are you seeing that they are quicker to come into their bodies? What is your experience with that?
No, it's a great question. I've learned in the first few sessions, I'm watching for signs and I'm watching for patterns. Um, I have noticed that when I have a couple, that if within, I mean, I'm going to make this up because it's not always true, but like if I were to guess, if within the first 4 or 5 sessions, I'm not starting to see and feel like some type of calming or connection, because I've had, like, if I have people come in and every session they are getting really escalated, but at the beginning of the session, one or both of them is saying, "Hey, this is really hard, but gosh, I have been feeling a lot better or I've been noticing this is giving me hope, or right, if they give me feedback like that and but I still see a lot of escalation, and then I can continue to like proceed. But if I get it where I'm seeing the same de-escalation, I'm seeing um the same intensity or worse. Sometimes something that gives me a clue is when one of them, let's say, are like will turn their anger towards me as the therapist.
Mm, yeah.
That's something I'm always like, okay, that's okay. That happens. I'm fine with it, right?
Hmm.
But if I then find that session after session, that's not dissipating, I'm not building trust with them despite the efforts I'm making. I'm often going, gosh, this couple might not be ready. They might need to go back and just focus on some individual work for now. But so those are some of the things I'm looking for. I didn't even think we'd go into this today, but that answer your question?
That is helpful. And then, as a couples therapist, what is your engagement with the individual therapist?
That's a good question. So obviously, I, in order to engage with an individual therapist, I have to have a signed release of information. And as a couples therapist, I have to have a signed release of information for both people. And some people are like, well, that's weird. That's his therapist, not mine. And I'm like, yeah, but the relationship is my client, not either of you individually, right? So I get signed releases, and then I'll reach out and I'll say, hey, tell me what you're noticing. Is there anything that would be helpful for me to be aware of? Oh, and they'll ask me, like, what are you seeing with them as a couple? Because if I go do individual therapy for myself, I'm often going to present a certain way with my therapist. And then if I go do couples therapy with my wife, I'm going to present a different way with my wife. That's not abnormal, because for lots of reasons, right? And it's interesting how often I'll have one person in the coupleship be like, well, he or she is a totally different person. I don't think they're representing themselves the same way, or their truthful way, or whatever. And it's interesting because sure, they could be being disingenuous and whatever, but we act differently depending on the person we're with. We adapt. Either we're being mindful and trying to show up in a way that works for them, or they're triggering us, and so we are more escalated with them present than if they're not there with us, right? So then when I reach out to the therapist, I'm sharing what I'm seeing, they're sharing what they're seeing, they're telling me like, hey, here's what we're working on. I might let them know, here's what I'm working on. Uh, do you think I'm heading in the right direction? Or, you think I'm heading in the right, like, and we're exploring, trying to see if there's certain insights from either one of us that will help the other, help whoever our client is. Was
Are
that
you
was that the
sometimes, yeah,
information you
no,
were asking?
yes. And I've got more questions, you know me. So, and I'm also like, are you ever directive of this is what I'm seeing in the session? Are you able to be like, I think it would help each, this person and this person in their individual work if they were able to, unpack some of that, is that something couples therapists, would do, or and vice versa with individual therapists as well?
Yeah. Well, here's what's interesting, and this might sound a little funny. I'll get a bit opinionated here, and I want to make it clear it's just my opinion. I am of course biased. I have bias. But um, a couples therapist, like when I'm working with a couple, I will often say, hey, right, whatever we just unpacked right there, like take that back to your individual therapist. Tell your individual therapist, well, so let me pull that back. I'll often say, hey, did that feel like we're going in the right direction? And if so, if I get the feedback from the person like, oh gosh, I've just never understood this before, and I'm like, okay, take that to your individual therapy. I think you can do a lot of work in individual therapy around that. Now, And so I will recommend to the clients themselves, like, I think you could do some more stuff around that. Or if I know that they're doing like EMDR, I'll be like, hey, I wonder if it would be helpful to do an EMDR session around that. Talk to your individual therapist and find out if that would be good. Now, if you notice, I'm giving suggestions and ideas, but I can't guide their individual treatment. Um, and there's some things I think a couples therapist can encourage them to do that can be super helpful. I try to be careful when I call like the individual therapist, and I will very clearly say, "Hey, I've wondered if this would be helpful." But obviously, I'm not seeing the scope that the individual therapist is seeing. And so I'll say, hey, I've wondered if it'd be helpful. I'd be curious. Like that might be something you guys try. But like, of course, to go the direction you think they need to go. But I just wanted to let you know what I was seeing. And I've actually found that some of the scariest therapists, right, will say to me, and this is what I find intriguing as a couples therapist. Um, the some of the what I feel like at this point are the scariest therapists is I'll reach out to the individual therapist, and the individual therapist will tell me, "Hey, you need to get the partner to work on this." And I'm
Mhm.
going, "You've never met the partner. You don't know anything about them." Now, I don't say that. I just go, "Oh, okay." And because maybe there is something, and maybe what they're saying is my client is struggling with this. If this is happening with the individual partner, then that would be something I think could really help my client, right? But it's interesting over the years, certain therapists specifically who are like telling me, "Oh yeah, I think he or she is a sociopath or a narcissist." And I'm always just like, "Oh my gosh, your therapist is not should not be diagnosing somebody they have never met before." It always makes me super nervous, but and maybe that's way too much info,
No,
but
no, no. I agree, and this is true. This is the stuff that happens. These are the
yeah,
therapists
and
I don't refer to if I
well,
know, like, but it is really challenging, and they're, you know,
mhm.
but it also, part of all of my questions are, I know addicts who have gone and lied to their therapists for years and years and years,
Oh, totally.
and it breaks partners' hearts, and then they're escalated, and they
Yeah.
look like the crazy ones, and the other person gets to look
Oh,
like, look, and
yeah.
so all of this is really complicated. And I go back to why that, this is such an art form. And yes, if you have a team of collaborating, if they're a team and they're with you, that can help you. I always think, what is the goal? And if it is the goal just to get your partner to shut up, like, honestly, like, there's some really painful things that can happen, with all of that. So I think it's really important for all of the professionals to be clear on what ultimately is the goal. So, but yeah, I hear you and acknowledge that. I love that you were, I do the same thing. I'm curious about this. I mean, I'm wondering if you're seeing that. I do a lot of that too, because I find if I'm curious, I get a lot more
Oh,
information rather than, man, you need to work on that with, that
I
doesn't really help.
well, I was hanging out with a very talented therapist who I actually love and totally respect. And the other day it was mentioned with a group of us, this therapist was like, "Well, if if this could be reduced and you could increase this, that'll solve the problem." And
Oh,
I sat there and I went, "Well, I could see where that let's say 80% of the time that solves the problem." And I go, "But man, if it doesn't, ooh, we could be introducing other." So it's a really interesting space because clients feel most comfortable in the beginning, at least, with an authoritative therapist. An authoritative therapist will tell you exactly what tell you what the treatment plan is, and here's what we're going to do, and it's going to and if you do these 30 steps, and right, like that, here's the result, and that feels so good. Like, give me the steps, tell me exactly what to do, and I want to get to the end of that and be cured. It's so comfortable to be told what to do. The unfortunate thing is, though, I'm not sure that that's the most powerful therapist. I think the most powerful therapist is, hey, I'm confident about the direction I can take you. I think it's going to be helpful. However, we're on a journey together. This is unique to you. And so evidence supports that we're going to go this direction, but the truth is that this might not be exactly what you need. This might not be right for you. Let's figure that out together. And you, as the client, are the expert on you, right? And that's what I try and tell everybody. Like, just because I have a ton of experience and I love doing what I'm doing and I've helped a lot of people, the truth is, I'm not the expert on that individual person. And I work hard as a clinician to try and teach people that, hey, I'll own in front of people, look, I might not be getting this right, but this feels like the right direction. So unless you guys say otherwise, let's go this way and let's figure it out together. And people will tell me, gosh, I wish you were more, well, they don't say the word, but like authoritative. And I'm like, yeah, it feels more comfortable. We would love it if we go in and we've got cancer and our doctor says, you know what, 100%, we're going to beat this. This is exactly what we're going to do. It saves everyone. It's like, sure, it feels great when somebody else can regulate us and be so confident, but it's a scary and dangerous place to be, I think. So when I'm staffing with other therapists, I'm exploring with them like, hey, tell me if you're seeing something I'm not. And even if a therapist says to me, well, you need to teach the other partner this, I'm always like, okay, well, that's good to know. Thank you. Like, I will try and hear it from, man, I hope they didn't mean it like they know for sure. I'll just take that as a suggestion, right? But oddly enough, when I'm collaborating with therapists, my favorite ones are the ones where we're like, hey, this is a practice. We're practicing this together. We're all trying to figure it out. We're going to get some things right. We're going to get some things wrong. So that was really long-winded, Tammy.
Yeah, no, and that's why again I go, this is an art, not a,
It is.
yeah, I love math. Math is really easy. It's not, no, you do these things and you have an equation and you get an answer and it's right or it's wrong, but with this, it's, there's so many nuances, and you can have two couples come into your office with similar stuff, and they may need completely different approaches to their coupleship, so I think it's really important that the person that you're with, that you can trust that they are working for your overall,
Hmm.
betterment, whatever that looks like. So, in fact, I often say, if it with addicts, if they really like their therapist, their individual therapists, I have concerns sometimes because they may not be, no, seriously, because
No,
they may not be holding them, accountable. They're going like, well, you're trying, and I'm
well,
going like,
sure.
you need to have the structure and support.
One of my first sessions, I think usually in my first session with every client, now that you mention it, I use a phrase. I go, look, I want you to like me as a therapist. And I said, but when I hire my own therapist, I don't want her to be in this case, my current therapist is female. I don't
Mhm.
want her to be my friend.
Right.
I want her to kick my trash. Like, I want her to help
Yes.
me
Yes.
dig in and because I don't need to pay somebody to be nice to me.
Right.
Like,
Right.
she's amazing and she's super
Yes.
kind. And at the same time, she's like, I'm gonna make you uncomfortable
Yes.
because how
And
else
I'm
am
with
I?
you. I want to respect. I respect my therapist. I appreciate her. I have a her too, and
Right.
it's one of those things. But I know that she can help me. Like she's going to see the blind spots and
Yeah.
the things I need to address. And I don't want somebody to go, well, you're trying,
Uh-huh.
and you've got a mean old whatever. No, it's like, here's where you are. These are the realities. So, okay, we've got some questions, and I may get more curious about it because I saw them. So,
Let's do
hey, Tammy and Matt, both my wife and I listened to all the Seeking Integrity webinars throughout the week. Wanted to say thank you for all you do. I have a general question about couples therapy. Both of us have Their individual therapist, myself as the porn addict, have completed Porn Addiction 101, parts 1 and 2. That's the online work group, and currently in healthy intimacy with Scott and attend 6 groups a week. It has been 4 months since D Day, and full disclosure, is this an appropriate time frame to start couples therapy? That's a great question.
It is a great question. So, Mike, I'm gonna give you let's talk about a quick principle here that's might be, oh shoot, I shouldn't have said that out loud, should I have?
It's okay.
Um,
There's a zillion mics in the world. We do
all
not know
right,
who this mic is.
all
So
right,
it's
fair enough.
okay.
That's my bad. I'm gonna give you some unsolicited advice. The first thing that popped into my head is, well, so first thing that popped into my head is, dang, you're working hard. And I'm honestly like I'm proud of you both, and that's awesome. The second thing that popped into my head is 6 groups a week. I was like, hey, just make sure you're getting all the self-care you need and that self-care isn't just groups. Like make sure you're
It could be 12-step groups too. So like
Oh, it could be,
eat
and I
a,
guess,
yeah.
and I
And
guess early on, if you're doing like 90 and 90 or something like that, right?
exactly. I
But
made the gracious assumption that it included those kind of things. So yeah.
yeah. And so there's a part of me that I would say, okay, so first of all, if all you're doing is recovery all the time, then I'd be nervous about that. But obviously do your recovery all the time. Just, make sure you're having enjoyment and other good parts of your life in there. So if I were to go back to what I started talking about early on, if you both feel like you're doing a decent job of like regulating when conflicts arise, even if you're just getting stuck and you don't know how to move through them, then 100% jump into couples therapy right now. Like I would talk to the therapist, make sure, like do your best to see if they have um the skill of like working with couples that are early in recovery, like ask them maybe how often they work with couples that are early in recovery. But to me, I would look at this and I'd be like, oh yeah. And here's the thing. If you get into couples therapy and you find so like a little bit of like I don't know how else to say this, a little bit of digression, right? Like in the sense of like I'll tell people it gets worse before it gets better, even in couples therapy. Like when you come in, I'm going to start pulling stuff out and we're just trying to make sense of it. But if after 4, 5, 6 sessions, if you're like, gosh, this is still getting worse every time, I might say, okay, you might want to pause. And I would share that with the therapist and say, hey, this feels like it's going on, like it's not getting any better. It's making things worse. Then like anything, then you practice regulating and then step back in. Like that might be where I go, okay, let's pause couples. Let me go back to let me do some sessions with my individual therapist to figure out why I'm dysregulating so much. Let me practice those skills, then let me get back into couples therapy. So my thought is, I don't know why you wouldn't, but if the both of you, or at least one of you, can do a decent job of regulatory skills, then I say, sure, give it a shot. And if you find too much dysregulation, too fast, too much digression in a sense, then you might need to pause. So how's
And
that?
yeah, and my we haven't talked about this, but I have done some research on conjoint couples therapy, and there's a difference between couples sessions and couples therapy. That was another question I was going to talk to you about. Because like early on, it could be some stabilization and things like that. So there could be some sessions where it's not digging into all the relationship stuff. It's just like Matt was talking about. We're coming in, we're so dysregulated and we can't do anything to help us make progress in things. So it kind of depends on where you're at. It sounds like you are doing good work, and and that's, I always say, front loading, especially for addicts, building a solid foundation, really, can make such a difference for you. So, but conjoint couples therapy is both of your individual therapists working with both of you. And often that can be helpful from the stand because there aren't, Matt's a great couples therapist. There aren't great couples therapists everywhere. So sometimes if the individual therapists are, that was true. If your individual therapists are able to do that, then they can see you in real time interacting and
Yep.
like that can be really helpful too. So, but I love what Matt was saying. Try it, and if something is, like take a pause. It's kind of breathing in and breathing out. What do you need? What do you need right now? And all of that. So, and even if you're doing conjoint, sometimes it's like, well, we do that once a month and see our individual there. It like all of this pacing, all of this is, like I think I hear from people who go, this is what we do versus, talking about what do we need now? Like this is all kind of phases and chapters. And so if you go, well, that helped really a whole bunch early on, but now we're in a little different side. So now we need something different. It's okay to look at that, and that will continue the kind of that ebb and flow of, what you need in the relationship in that moment. So and thank you, is was the comment. You're very welcome. Thanks for being here. Okay, so
Yeah.
I sat in on a support group yesterday, and the facilitator said she advises couples to divorce if she doesn't think they are progressing. I found this incredibly troubling because I feel like the counselor should be empowering the client to make their own decisions. As a partner that had their choices taken away, I find this damaging. What are your thoughts on this?
Um, again, it's really interesting when people come in, even so, it's so funny. I totally want a tangent, but I think it makes sense. Okay. So you have different types of licenses for therapists. You have marriage and family therapists, you have social workers who are therapists, and you have professional counselors who are therapists. Now, oddly enough, each training, and then you also have like psychologists who are therapists. So there's others as well, but even a psychiatrist can act as a therapist. But like a marriage and family therapist, most of their studying is understanding family systems and that sort of thing. But really, once you finish school, you then go in and you learn your different modalities. Like I've done a lot of EFT training and love the emotionally focused couples therapy stuff. I've done some others as well, um, but what's funny is that I've had people tell me, "Well, you're a counselor," because technically that's my license, right? I'm a licensed professional counselor. So why aren't you why aren't you giving me counsel? That's what people will say. Like, why aren't you giving me counsel? Now, I haven't done the work to go back and figure out did it back in early times, did a counselor do this and a marriage and family therapist do that, But at this point, everybody I work with, it almost doesn't matter what licensure, whether they're a marriage and family therapist or a counselor or a social worker. Um, well, you end up doing therapy typically similarly, and most of us are not giving advice. Again, the danger when a therapist gives advice is that they are actually creating dependency on the therapist instead of empowering the client to figure things out for themselves. People have asked me, when do you recommend divorce, right? And I would like to think the answer is never, meaning I wouldn't recommend divorce like I wouldn't recommend someone stay together. And that's another thing that is interesting. People are like, well, you're a couples therapist. Why aren't you telling us we should stay together? And it's the same concept, but somehow people think, well, I get why you wouldn't tell people to stay divorced or get divorced, but why don't you tell people they really should work harder to stay together? And I'm like, how's that any different than telling somebody to get divorced? Right? You guys really should stay together. Okay, so now in the authority and power, because I have an authority role, although I don't want to be authoritative as a therapist. I'm in a position of power as a therapist, even though I don't want to use that power to take away somebody else's or to exploit anybody. And so, but for me to say to somebody, boy, you guys should really stay together. Now, there are times where I've said, hey guys, from what I'm seeing, I think you guys can figure this out. I think from what I'm seeing, from the information I have, I think that you guys have the ability. Now, that doesn't mean you should. That doesn't mean you will, right? I've said things like that. I have also said to people, hey, guys, as much as you've been working at this, what prevents you from getting a divorce? But again, it's more of like, tell me why you guys stay together. And people might infer that I'm saying you should get a divorce. People might infer that I'm saying you should be able to make this work. And really I'm trying to spur like thoughts in somebody to figure out, why don't we get a divorce? Well, I don't want to. Like that might cause somebody to engage better, stronger, more committed in the relationship. And it might cause someone to go, you know what? I don't know. I just have always told myself that divorce is not okay. And I'm like, why not? Why can't it be okay? Why can't it be the best thing that ever happens to a person? I know in my mother's case, should have happened way sooner, if that makes sense. And I can say that as her son living in that house, right? Like it would have, but at the same time, as a clinician, I would agree that that is a very dangerous place for for a clinician to go, because you don't know what wounding you're leaning into. If that person, let's say the person has grown up in an environment where they look to an authority figure to make choices for them, and I say, you know, you really should get a divorce, and they're like, oh, okay, you know what, maybe you're right, and now they go get a divorce, when what I need to be working on is talk to me about why you look to an authority figure to make choices for you, right? And I do that. If somebody asks, do you think I should divorce my partner? I'll ask one question. I'll be like, what does it matter what I think? Well, I don't know. You see lots of couples. And so, and then I can lean into, um, but what if I'm wrong? And that's an uncomfortable place. Well, I'm paying you. Yeah, I know. You're paying somebody who gets it wrong sometimes, right? Like, and so it's just such a fascinating place to be, and to help clients then figure out, like, how do I empower myself to figure out what I want, figure out what I believe. And so yes, it can be damaging. And also, to be honest, I don't think for some people it's not damaging at all. Meaning therapists make mistakes, and if a therapist says, you know, you should get a divorce, and that person's like, yeah, you're probably right, and they get a divorce, and they look back and they're like, it wasn't damaging. I don't think my therapist should have told me that, but I did the right thing. You know, like it's interesting how that can, it could not be damaging. It also could be very damaging. It really just depends on that individual. This is something I've said on here before, that occasionally I've gotten some pretty or not even on here, I've said it elsewhere, and I get some pretty interesting feedback. I personally don't think it's the right move for a therapist to say, "Oh, you've had disclosure. All right, well, here we're gonna do a full disclosure. We're gonna do a polygraph. We're gonna do." I understand why that feels good, but when I'm with clients and they say, "Hey, we've heard about disclosures. We've heard about polygraphs," I'm always like, "Yes, let's talk about them as a tool. Let's talk about when they're useful, when they're not, how they're helpful, how they're not. You're going to make the decision." Right? Is how I'm always at it. And and if somebody's like, well, do you think a polygraph or a full disclosure, a formal disclosure and a polygraph would be helpful for me? I'm like, well, I'm not exactly sure. It could be. Let's talk about why. It might not be. Let's talk about why. So a therapist telling somebody an exact prescription always gets me a little nervous. In some cases, maybe extreme cases, it might be needed in order to get somebody stable. And at the same time, for the most part, I try to avoid it as a clinician, and I think most should. That, again, very long-winded.
Yeah, well, and I've got lots of big surprise thoughts on this one too. We weren't in there, and I'm reading what you're saying. And if she literally said, I advise couples to divorce, there's no context of, is this, 2 months in, or is this 5 years in and things are still chaotic. I was also thinking, and this is, a personal thing. A long, long time ago, I was married to somebody, and I, I was seeing a counselor, and he said, what you see modeled it was a really healthy relationship, is not pie in the sky. That's what it's supposed to be. I did not have that with my then, current husband. And I would anticipate that that would be advising me to get a divorce. And he never said, I'm advising you to get a divorce, but he sure laid it out for me. And I chose to. So grateful I did.
Well,
So there's also the nuances of, like, was he advising me to get a divorce? Probably, but in a really, like, you get to pick. But I want you to have clarity of, this is, what you have is really unhealthy, and what you're seeing modeled over here was really healthy. And I left that marriage knowing, if I never was involved with somebody else, I would be much better off. So I feel like there's a whole bunch of things, and I
oh,
have been misquoted so many times. So, like, somebody will say,
totally.
well, you said, and I go,
Yeah,
that was not what I said. I wasn't there. So I'm taking you at
right.
your word that this person said that. But there's all of this other context. Is it like they've been 5 years in doing the same thing over and over again?
Mm,
Nobody's willing to move or do that. And is it, have you considered, other options? There might have been, a lot, sharing something in a group where you're giving it in a sentence versus, here's all the
yeah.
context of when I would. So that was my thought.
There's two pieces I'll add to what you just said that
Please.
I love. The first one is, I'm going to assume for a second that what this person was saying is, and I'm going to frame it in the form of a question instead of a statement. Let's say that this person was saying, I advise couples to figure out how long are they willing to stay stuck and not progressing before they decide to just divorce. Like, it's more of, gosh, how, like, if you're not progressing, you should divorce. It's more of, how long are you comfortable not progressing before a divorce just makes sense, right? Like, because I tell every client, couples included, if you think that divorce is off the table and that it's not allowed, I'm nervous for the healthiness of you and your relationship. Right? I don't know any reason why divorce should ever be like not an option. I hope that's making sense. Like, I think every relationship, divorce should be an option that's always on the table, not as a threat, not anything like that. But if we don't have any rules, any boundaries in which divorce would be justified or okay, then I'm worried that that's not healthy. And that might sound strange, but the second thing I was gonna throw in here, I totally forgot. So, oh, I think I was gonna say, there have been times where I have said about the strongest I've ever worded it, and I'll usually preface it like this. Um, if you were my son or daughter, and I had the information that I have about you, I would probably have a hard time not telling them to get a divorce. Right? And what I'm saying is, I realize I'm blind to the full picture, and there's no way for me to know everything. But even with my own kids, there's been times where I'm like, "Hey, you need to make this choice. But here's what I'm really nervous about. I wonder if you'd be happier if this." And then it's like they have to go figure that out. And um, it's one of those that like as a clinician, it's being careful that I'm saying to the person, you really need to think about it. And at the same time, that choice still is 100% yours.
So last question. I'm very early in the process of being a betrayed partner. What do you think about joining my partner's individual session intermittently if he needs to say something to me, or maybe vice versa?
All right, so this is what's called collateral. So in a therapist, so if I'm seeing an individual client, and they have a family member, a friend, a partner who joins the session occasionally, you're joining as a collateral. So when you go into that room, you know that the therapy is not for you or about you. It's still about your partner's therapy, and that you're there to assist his or her therapy. And so you are going in as a collateral to their therapy. Hopefully, your therapist has you sign a collateral form that explains that. Um, and I don't know why I thought I would just give you that information. But so what do I think about it? If you know you're going in and you're not doing couples therapy and you understand the nature and the scope of that situation, heck yeah, I think vice versa. It can work either way and be super helpful. But just understand that when you do that, you're going in for, like in this case, you said if he needs to say something to me, so his therapist is supporting him, his or her therapist is supporting them in sharing some information with you as a collateral and that they couldn't do out on their own. And so they're practicing getting vulnerable with you and you're listening. But then I'm going to want to, hopefully, you're being told, hey, let's have him or her share this with you. And then, um, if you could try to, express some empathy or some whatever, and you're able to go, maybe I can, maybe I can't, and but you're understanding what your role is there. Hopefully, in that situation, especially if you're doing it intermittently like that, you're not doing couples therapy. You're doing therapy with your partner's therapy as a collateral, and you're actually just trying to help progress them. It may be helpful for you. It may be a great thing, but you're not it's not couples therapy, which is fine. Nothing wrong with it. And if their individual therapist is or they themselves are requesting it, then that's great. If it starts to move into couples therapy, then you need to establish that understanding. Most likely, you're then signing consent forms, and you're typically no longer doing individual therapy, you're doing couples therapy. There are some exceptions to that, but I won't get into that.
No, and in this arena, I mean, with betrayal and things, yeah,
Yeah.
it gets really messy. So having, and then I mentioned conjoint couples therapy or conjoint sessions. It could be that you have your individual therapist, he has his individual therapist, and every now and then, like you said, on an intermittent basis, you come together so that you can all process through things. That could also be an option for you. But yeah, my experience, and it's different than Matt's, but my experience is often partners are going in to share information because what the betraying partner, the addict partner, the lying partner is telling their therapist may or may not be, well, is unlikely to be, accurate and true. And so having the information of like, yeah, this is what I'm really seeing, in our household, and this is how he's showing up and whatever. And it could be like, I'm seeing progress. Like it doesn't have to all be like the bad report card. It can be, I'm seeing progress in these ways. And like, so yay on that, but here's some options or opportunities, to make some progress in this. I'm looking for some help around these lines. So again, this is, unique and individualized, and, and identifying what you need, and then sharing with your therapist. This is really helping. This is not feeling like it's tracking. Can you help me in this area? Advocate for yourself with your therapist too. I find that often doesn't happen. It's just like, well, I need to go for another therapist. And I'm like, if you have the conversation with your therapist, they may go, oh, I great. Thank you for the information. And, we can, and they may go, that's outside the scope of my wheelhouse and I'm going to refer you. And that's all good too. But then guess
Oh,
what? You get what you need. So, okay. Thank you, Matt. I won't be here in 2 weeks. I'm going to have Scott here. So I
nice.
will send all the information. But yeah. So, but Matt will be here in 2 weeks. So, all right, everybody. Thank you.
Yeah, everybody.
Bye.
Thanks, Tammy. Bye.